Mr. Speaker, today I laid for information the annual report of the Registry General for the year December 31st, 2021. The Registry General recognizes the essential role that vital statistical information plays in planning for the provision of services in areas of tourism, health, education, and housing, to name a few, and has performed his duties to a high standard in recording, collating, and presenting of the data to be included in the annual report. Mr. Speaker, in accordance with Section 19 of the Registration, Births, and Deaths Act 1949, the Registry General shall, within 90 days after the expiration of each calendar year, compile for publication in such form and manner as the Minister may approve a summary of births and deaths which occurred during the year, together with a general report of the increase or decrease of the population of Bermuda. The registrar is required under Section 35 of the Marriage Act 1944 to publish a summary of marriages conducted each year. In preparation of the report, the registrar has relied on information received from the Records Office of the King Edward VII Hospital relating to births from the local funeral directors and medical practitioners in relation to deaths, and from local marriage officers and masters of Bermuda registered ships in relation to local and maritime marriages, respectively. Mr. Speaker, the report, which deals primarily with the vital statistics pertaining to the island's residential population, indicates that there has been a slight decrease in the number of births. In 2021, there were 494 births, a decrease of 47, or 8.7%, over the 541 births recorded in 2020. Also, the live birth rate of the population has decreased by 0.7 point per thousand, from 8.5 in 2020 to 7.8 in 2021. There was one baby born at the residence of the parents for the year ending 2021, which was the same number of babies born at home in 2020. Mr. Speaker, the distribution of live births by nationality based on information provided by the parents at the time of the registration of their child's birth for 2021 reflects 76.9%, or 380 of the total live births have at least one Bermudian parent. In 2021, 114, or 23.1% of births have parents who are both non-Bermudian. Mr. Speaker, honorable members are advised that in 2021, 727 deaths were recorded among residents. A death rate of 11.4 per thousand of the population for 2021 reflects an increase of 161, or 28.4%, for 566 recorded in 2020. The report also indicates that there were 3 deaths in respect of non-resident persons, which brings the total number of deaths recorded for 2021 at 730. Also, there were no stillbirths recorded in the 2021 period. Mr. Speaker, there was a decrease of 233 in the estimated resident population at the end of 2021 at 63,648, as opposed to the 63,881 residents in the population estimated in 2020. At the end of 2021, there were 2,468 more females than males in the population figures. However, from the report given and statistics recorded since 2017 and statistics provided for 2021, it would appear that there has been a significant drop in the population from statistics recorded prior to the year 2017. Honorable members will note that the population estimates were rebased in 2016 after the conduct of the 2016 Population and Housing Census. The rebase of the data is a reason why the population estimates are lower from 2016 forward. Mr. Speaker, for the year ending 31st of December 2021, there were 313 marriages performed in Bermuda, a 65 or 26.2% increase from the 248 marriages recorded in 2020. The increase can be attributed to the relaxation of social gatherings and international travel restrictions due to the COVID-19 pandemic, which appealed to couples wanting to marry that year. During 2021, marriages between parties who were both non-residents accounted for 66 or 21.1% of the total of 313. This figure for the second consecutive year breaks the trend where marriages between non-residents to exceed where marriages between non-residents, to exceed the number of marriages between residents, and marriages between residents and non-resident parties. The report also shows that there were 211 marriages between parties who were both residents and 36 marriages between a resident and non-resident. Mr. Speaker, of the 31 marriages recorded in 2021, 3 were same-sex marriages, which represents a decrease of 7 or 70% from the total of 10 same-sex marriages in 2020. All 3 same-sex marriages were performed by the Registry General's office as civil ceremonies. During 2021, same-sex marriages between parties were both residents accounted for 2 or 67 of the total of 3 marriages. The report also shows that same-sex marriages between a resident and non-resident accounted for 1 or 33%. There were no same-sex marriages between non-resident couples in 2021. Mr. Speaker, 28 marriages were performed on board 28 Bermuda registered ships in 2021. This total represents a decrease of 42 or 60% from the 2020 total of 70. Of the 28 maritime marriages, 1 was a same-sex marriage ceremony. The decrease is due to the COVID-19 pandemic that brought the cruise line industry to a halt in March of 2020 and did not resume operation until October 2021. There were 28 maritime marriages registered between October and December 2021. The cumulative number of marriages, local and maritime, processed through the Registry General for the year ending 31st of December 2021 was 341 as compared to 318 the year ending 2020. Mr. Speaker, the Domestic Partnership Act 2018 allowed for formalization of unions between parties. In 2021, there were 6 domestic partnership unions recorded for that period. 5 other domestic partnership ceremonies were performed at the Registry General office, and the remaining 1 ceremony was performed at an alternative approved location as allowed under the Domestic Partnership Act of 2018. In closing, Mr. Speaker, the annual report seeks to provide an illustrative statistical digest of vital events such as live births, deaths, stillbirths, marriages, domestic partnerships, adoptions, and re-registrations of births for the year ended December 31st, 2021. Thank you, Mr. Speaker.
Thank you, Minister, Deputy Premier. The next statement this morning is in the name of the Minister of Education. Minister?
Thank you, Mr. Speaker, and thank you, colleagues, and welcome and hello to the listening audience. Mr. Speaker, this morning I rise to provide this honorable House and the community at large with an update on the opening of signature schools and the introduction of signature learning programs in our 2 senior schools, the Barclay Institute and Cedar Ridge Academy. This is undoubtedly a significant milestone achieved in the ongoing work of education reform for our public school system, work that has covered some 30 months of belief and determination. Mr. Speaker, much work has been and continues to happen to ensure that our children Bermuda's children have an educational experience that prepares them for their future and connects them with their community. As you have heard me say on several occasions, Bermuda's children are Bermuda's future. With this, Mr. Speaker, it is with great pleasure and gratitude to inform this House that on Monday, September 12, 2022, we celebrated a new chapter in education reform. On this day, a total of 289 incoming S1 students entered the Barclay Institute and Cedar Bridge Academy to undertake signature learning programs in health and social care, finance and insurance services, STEM, or science, technology, engineering, and math, and trades and professions. Mr. Speaker, in celebration of this new chapter in learning for our children and Bermuda, the school hallways at both Barclay Institute and Cedar Bridge Academy were lined with students, educators, school leaders, ministry and Department of Education staff, alumni, and community partners as they clapped the procession of incoming S1 students who will be embarking on a transformative journey and a new way of learning. Mr. Speaker, I was deeply moved while welcoming our S1 students at both schools, knowing of the work and effort, some 30 months worth, that had been put into implementing the signature schools and their signature learning programs that will serve our children well for the years to come. Mr. Speaker, this is the change our community has been demanding for years. Learning for our children that is personalized, flexible, relevant, future-focused, inspiring, and authentically Bermudian. Areas of learning that students have chosen for themselves, learning that will open up further study and career opportunities. Mr. Speaker, the Signature School at the Barclay Institute will feature signature programs in finance and insurance services, which include programs in accountancy, banking and financial services, business administration and management, fintech, and insurance. The other signature program is health and social care, which includes holistic and allied health care services, medical sciences and services, social sciences and services. Mr. Speaker, the Signature School at Cedar Bridge Academy will feature signature programs in STEM, science, technology, engineering, and math that include animal and veterinarian sciences, computer science, creative technologies, engineering, and environmental sciences. The Trades and Professions Learning Program will include automotive technology, carpentry, cosmetology, culinary arts and hospitality, electrical, horticulture, and textiles and design. Mr. Speaker, in my press release on the first day of the academic year, I said this change has been built by Bermudians for Bermuda through engagement with teachers, students, parents, and business and community leaders. I take this opportunity to acknowledge and sincerely thank every educator, school leader, learning partner, and team member who has contributed to the most significant and essential cause of doing what is best for our children's futures. Mr. Speaker, the learning that our S1 students are currently engaged in will create a generation of young people who are engaged, adaptive, entrepreneurial, innovative, culturally connected, and empowered. These attributes will shape our young people to be the creators of future jobs, to be active citizens, and to tackle increasingly complex challenges. Mr. Speaker, while I am excited for what we have achieved to date, this is just the beginning. While our educators at the Barclay Institute and Cedar Bridge Academy are delivering our first year of signature learning programs, they are also beginning to work on developing what is required for the S2 and S3 levels. And we are not just stopping with what happens at the signature learning programs. Teams of teachers at both senior schools are focusing on redesigning the first two disciplines in the core curriculum, mathematics and science, and on scaling a new model of advisory which caters to the more critical than ever area of social emotional learning. Mr. Speaker, while so far my statement has been focused on providing updates on achievements and work underway at the signature schools, it would be remiss of me not to quickly refer to the remainder of the school transformational work underway. This includes the developmental work to prepare the third signature school offering hospitality and tourism and educational services, signature learning programs, and the phased introduction of parish primary schools at Francis Patton and Purvis primary school sites. Mr. Speaker, whether it be the 93-year-old Mr. Furbett, whom I spoke to at the parish primary school pop-up at Kroll gas station last week, the parent I spoke to at the senior signature school pop-up at the National Library last week Friday, who has sent her children overseas for school, the young professional who spoke about her child at a public primary school when I stopped to visit the pop-up team at Linda's in Devonshire on Monday evening. And lastly, the mother who told us about her older children's struggles in the public system and the hope she saw for her younger children at the pop-up at Nellie's Walk on Wednesday. The thoughts expressed have been the same. This is the change our community has been asking for. Mr. Speaker, before coming into power, this government made an earnest promise to Bermuda and her people that it was to reform public education by phasing out middle schools and introducing signature schools at the secondary level. Our public school system is moving in this direction. The legislation was passed last year to shift from a three-tier to a two-tier system. This year, the phased introduction of signature learning programs for our S1 students was achieved. We will continue in a staged way to transform the quality of public education so each and every young person in Bermuda can achieve great learning and life outcomes. Mr. Speaker, this government is serious about transforming school education because we value our young people. This is demonstrated not only by our commitments, but by our approach to delivering on those commitments. Of course, we are focused on quality and fidelity. But given that so much work is unprecedented in Bermuda, we need to balance that with a new set of practices centered around collaboration, a learning mindset, and large doses of determination and perseverance. This will ensure that we continue the work to reform our public school system. Mr. Speaker, important work that is to create the necessary opportunities for our children to follow their passion and interests, build on their talents and capabilities, and achieve their career and further aspirations. We will continue to be relentless in our focus and efforts because work is to impact future generations, and not just our children depend on this work, but also the success of Bermuda. Thank you, Mr. Speaker.
Thank you. Excuse me. Thank you, Minister. The next statement this morning is in the name of Minister of Health. Minister, would you like to present your statement?
Yes, Mr. Speaker and honorable members, last year the government of Bermuda took the first steps towards delivering on its promise to implement universal health coverage for all residents. Our vision for healthcare seeks to ensure that all people have equitable access to needed, informative, preventative, curative, rehabilitative, and palliative essential health services of sufficient quality to be effective, while also ensuring that people do not suffer financial hardship when paying for these services and critical medicines. As I have said before, Bermuda is very fortunate in that we have a health system that is well developed and well supported by dedicated professionals. However, the overall lack of affordability and sustainability of our health system is alarming for this government. Bermuda has one of the highest per capita health expenditures globally, but our population health outcomes do not reflect this. Mr. Speaker, this journey of change is complex, but our goals are clear. We must achieve better health outcomes, particularly of chronic disease management. We must ensure the availability of essential health services that residents can be confident that they can afford when they need them. We must strive to be efficient and effective in the delivery of these services and eliminate waste and duplication where it occurs in the health system. Just how important is this journey of change? Mr. Speaker, Dr. Dean Okereke of the Bermuda Hospital Board is the project lead of an eye-opening study of super users of the hospital's emergency department. Super users are individuals often with complex care needs who make disproportionate use of health resources. Of the 778 emergency department visits in a year made by the top 50 most frequently attending super users, there were 101 admissions, resulting in 1,002 inpatient bed days. While 10% of attendances at emergency are for scheduled visits, such as IV medications and blood transfusions, 60% of patients present with the same issue nearly every time, and chronic conditions are a recurring theme. I know I need not remind this honorable House that emergency department treatment is one of the most expensive ways to receive regular medical care. But if you are uninsured or underinsured, it can be viewed as a viable option. A roadmap of our health system is necessary to help these individuals access care more appropriately to ensure that we as a community make best use of our vital hospital resources and to deliver better care of value for all of us. Mr. Speaker, honorable members will recall last year the Ministry of Health brought together a core group of stakeholders from across our health system to serve as the UHC Steering Committee. Supported by KPMG, the the steering committee developed a high-level roadmap for strengthening Bermuda's health care and delivering on universal health coverage. The committee took note of healthcare systems in other jurisdictions, and it is clear that there are many different systems used worldwide to achieve universal health coverage. However, it bears repeating that the approach taken here on our island must be Bermuda-centric. Mr. Speaker, we know that the goal of achieving universal health coverage will be accomplished in stages over several years. During this time, this government will work with our many stakeholders to ensure our decisions and actions are based on and framed by a patient-focused approach that puts the patient's experiences and outcomes at the center of the work on universal health coverage. Mr. Speaker, since delivery of the roadmap, the UHC Steering Committee has restarted its work, and it's expanded now to include the Chief Medical Officer, representation from the Department of Information and Digital Technologies, and a new patient representative. In this foundational year, the ministry is working with the steering committee on a number of priority projects. One, the National Digital Health Strategy. A project working group is set up to deliver on a throne speech initiative to deliver a national strategy for digital health that leverages health information systems and connectivity to capture improvements and efficiencies for patients, healthcare providers, and health system payers. Digital health innovation is more than electronic medical records. It has the potential to be a key enabler in the transformation of Bermuda's health care system. Number two, merging government insurance funds. Another project working group is driving forward the merging of the government insurance funds, which is also a throne speech initiative. The group is starting with the administrative merger of the government employee health insurance with the health insurance department. Management Consultant Services is working with the different departments to develop a new operational chart and identify and access service efficiencies and gaps. Number three, agreeing our starting points. The work of determining the baselines of our population's health needs is just starting now. It is important to know and agree our baselines to ensure our efforts are aligned with what the community really needs. With that established, the baselines provide a meaningful starting point for the metrics that will monitor and measure our performance in the future. It is not enough to simply make changes. We must know the improvements those changes bring and know also when we need to correct course. We are fortunate to have project management assistance from this with respect to this particular element from the public registrars in training with the United Kingdom's Health and Safety Agency. Mr. Speaker, I will pause here to bring to the attention of honorable members a survey currently being conducted by the Bermuda Health Council. The purpose of the survey is to understand the different views of people about health and illness. The survey is intended to support and enable improvements to the healthcare system. This is another step on our journey, and I would urge the public to go to bhec.bm to express your interest in participating so that we can continue to build our information base. Number four, integrated care pathways. Work on this throne speech initiative is due to begin shortly. Supported by KPMG, the intention is to map selected patient care journeys to provide a comprehensive view of the current state of care for specified conditions. The objective is to address the highest priority and highest care needs first, deliver value, and of course be patient-centered with an integrated approach to the care delivered. The mapping exercise will bring out opportunities to improve care and address pain points, both clinical and organizational, along with whole pathway, and we welcome this. Number five, develop PAN systems for governance. There are many stakeholders involved in Bermuda's healthcare system, and the transitional governance framework is organized to provide a structure for contributions and information sharing across the whole of the system. With the UHC Steering Committee overseeing overall progress towards universal health coverage, a number of additional stakeholders, working groups, and forums will provide a crucial opportunity for joined-up and timely collaboration on projects, policies, and plans. Mr. Speaker, these stakeholding working groups and forums are being formed now, and they are as follows. The Clinical Senate, comprising a wide range of the system's practitioners and professionals, plus the statutory board chairs, and they will focus on medical and health matters. Health financing. This is a group for those involved in revenue raising, pooling of funds, purchase and provision of health services, where the chief focus is on strengthening health system financing. We expect employer groups to be well represented here. Health insurers, and have been invited to form a group to provide critical technical input on risk pooling, benefit design, service costs, medicine costs, usage, value, waste reduction, etc. And these are matters also as arise. And then the Health Advocacy Forum will advocate for patients' health and well-being with a focus on health equality. We anticipate active participation and engagement on the part of patient groups, unions, and the third sector organizations. And finally, the Service Providers Forum. This will engage the range of provider organizations and practices working within the health system, such as diagnostic labs, health and hospital centers, and medical practices. The chief focus will be on business operations and access to care. It is distinct from the clinical senate, as that is the business-centric rather than the treatment of care-centric. Mr. Speaker, we recognize that there is an overlap between these stakeholder working groups and forums, and indeed overlap of representation between the groups, and that is fine. The main aim is to provide a structure that supports opportunities for participation, information sharing, and feedback, as well as discouraging silos. Invitations to participate in the stakeholder working groups and forums are being issued now, and I would appeal to the chairs of the numerous boards, councils, and associations who have received or will receive an invitation to select designates from your group to be a part of this transformational program. As I've stated before, it is vitally important for the work on universal health coverage to include engagement of and collaboration with the wide range of stakeholders who form part of Bermuda's health system. We have a direction of travel, but there are many questions to answer and decisions to make that will need broader input than those represented solely by the UHC Steering Committee or the ministry itself. We know the insight and feedback of our health system partners will be invaluable as we improve healthcare access, experiences, and outcomes for all who live here, and we look forward to all of the many contributions. Thank you, Mr. Speaker.
Thank you, Minister. The next statement this morning is in the name of Minister Works. Minister?
Good morning, Mr. Speaker. Mr. Speaker, I rise to bring extremely positive news in relation to an election pledge made by this government in its 2020 election manifesto to improve the quality of life for all Bermudians. Mr. Speaker, honorable colleagues in the chamber today and the listening public shall already be acutely aware housing prices, mortgage interest rates, and rental prices have been on a continuous rise worldwide. In Bermuda, the monthly rental rates range as follows: for a studio apartment, $1,100 to $1,800 a month. For one-bedroom apartment, $1,500 to $2,000 a month. For a two-bedroom apartment, $2,200 to $3,000 per month. And for a three-bedroom apartment, $3,200 to $5,000 per month. Mr. Speaker, there's no denying that our island has extremely high cost of living, routinely in the top 5 in the world. I ask members of this honorable House, do we expect families to pay these exorbitant rates in comparison to their monthly income just to have a roof over their head, while in addition paying high utility bills, energy, internet, and phone, high fuel costs, and paying the ever-increasing grocery costs to simply survive in the modern world? The simple answer is no. This administration does not expect hardworking families to live in this manner without help from their government. While I fully support my cabinet colleague, the Deputy Premier and Minister of Home Affairs, in tabling the Fuels Act 2022 for the purpose of protecting the interests of consumers by ensuring fuel prices are fair and transparent, the government realizes that this is not enough to combat the heightened cost of living. Having frozen the price of fuel at the pump in February, more needs to be done, such as the duty reductions on essential goods. Therefore, Mr. Speaker, I'm pleased to announce that in addition to our efforts to assist in lowering the cost of living, the Cabinet has recently approved Phase 1 of a new housing initiative, a renovation scheme of 137 older housing units owned by the Bermuda Housing Corporation to increase the amount of affordable housing options for Bermudians. Mr. Speaker, I'd like to remind colleagues that the mandate of the BHC is to provide affordable, quality, and adequate housing and to promote home ownership to all Bermudians. The corporation operates 700 residential rental units and is currently at maximum capacity with a waiting list of approximately 129 families, inclusive of single individuals, a list that is ever increasing. Mr. Speaker, since January 2022, the BHC has been engaging in renovation works to several properties under its remit. As of September 2022, 17 units have been renovated and returned to the rental unit stock. 13 units as part of the routine maintenance program, while the other 4 units have been completed under the government's economic stimulus program. Through the economic stimulus program, a further 13 units are still under renovation in varying stages of completion, either awaiting planning approval from the Department of Planning or awaiting the conclusion of a procurement process. Mr. Speaker, this government realizes that this is not nearly enough to address the aforementioned waiting lists. To that end, we can report that the BHC has 137 older housing units that are in need of renovation to bring them up to the relevant building codes. 60 of these units are occupied, while the remaining 77 are out of service and will be added as new units to the inventory. This work will extinguish the entire vacant and derelict units owned by the corporation. Mr. Speaker, I know I've just announced numbers, so let me recap for those that may be following. The BHC has 700 units that are presently occupied, the maximum capacity. This renovation program, as approved by the Cabinet, will provide an additional 77 units to the inventory, bringing the total amount of rental units to 777. Mr. Speaker, to adhere to its mandate of providing affordable housing, the BHC will continue to use the rent geared to income-based scheme, which is capped at 35% of the total household income for these additional rental units. This system allows for low and middle-class income families to afford a quality standard of living as well as save 10% of their household income. Mr. Speaker, for emphasis, that's 77 additional affordable rental units set to be available through this residential renovation program and the economic stimulus program. Though the Ministry and the BHC are working diligently to continue increasing this stock. The total cost of the program is estimated at $21,605,000 and will be spread over the next 3.5 fiscal years with an initial $4,250,000 capital grant set to be given to the BHC forthwith for the commencement of the program. The remaining funds will be requested through the relevant year's budgetary process. Mr. Speaker, to be more fiscally prudent in the completion of the program, the Cabinet also waived all customs duty fees associated with the importation of goods required, with an estimated savings of $3,240,750. Mr. Speaker, in its 2020 election manifesto under the category for improving the quality of life for all Bermudians, this administration pledged to continue increasing the stock of affordable housing throughout the country, expand rent geared to income programs, and construct residential developments in the economic empowerment zone to increase the supply of quality, affordable residential accommodation and drive down rental costs. This renovation plan does just that, the first phase of addressing affordable housing needs. Mr. Speaker, the next phases of this plan will include the development in the Hamilton Economic Empowerment Zone, the construction of affordable units for sale, and the expansion of the private sector rental program. This program allows for privately owned units to be rented to the Bermuda Housing Corporation with guaranteed rent and intervention by the corporation when tenants do not honor their commitment. The rates are less than market rates, but the rent is guaranteed to be paid on time and the unit returned to its original state at the conclusion of the tenancy. Separately, we are looking at new ways to address the privately owned vacant and derelict properties to bring them back online. It's been more than 10 years since there was any type of building program. The perimeter lane condos were the last construction carried out by the corporation. None occurred during the OBA term, So we are starting again to increase the inventory. So, Mr. Speaker, I joined the Bermuda Housing Corporation Board, management, and staff in expressing our delight that funding has been provided for this initiative, and we can further deliver on the BHC mandate of providing affordable housing for Bermudians. Thank you, Mr. Speaker.
Thank you, Minister. The last statement this morning is in the name of the Minister of Tourism. Minister?
Yes, Mr. Speaker, I rise to provide an update on the state of tourism. Mr. Speaker, as we look back at the third quarter of 2022, Bermuda has seen momentum build after 2 years of a decimated global tourism industry. By the end of August, Bermuda welcomed over 98,000 air visitors to the island. While we are seeing growth year over year, we have not yet achieved the volumes of 2019. The Bermuda Tourism Authority projects Bermuda's year-end visitor volume to be approximately 56% of 2019. Mr. Speaker, some tourism measures have exceeded 2019 figures. Per person spending by air leisure visitors was up by 32% this summer. This means that today's leisure visitor provides more value to the economy. More is being spent in Bermuda's hotels, shops, and businesses at $2,030 per person than they did individually in 2019, when each air leisure visitor spent $1,534 on average. The average length of stay year-to-date shows that Bermuda's leisure visitors are booking vacations that are 11% longer than in 2019. The vacation rental category connects a wide cross-section of Bermudians with a new category of visitor looking to explore Bermuda from a local vantage point. It has been a vital shot in the arm to a segment of locals looking to play a part in tourism and earn extra income during challenging times. Significantly, occupancy in the vacation rental sector has grown more than 13% over 2019 measures through the end of August. Mr. Speaker, cruise travel is a critical revenue earner for Bermuda's tourism economy. Bermuda has enjoyed a strong cruise season with 116 cruise calls to Bermuda by mid-September. The team at the BTA projects cruise visitor volumes up to 400,000 passengers, contributing $162 million to the economy. As the pandemic has waned, Bermuda has relaxed some of the stringent requirements for travelers. Unvaccinated travelers are now being allowed to travel to Bermuda with some testing requirements currently in place. And the industry has been energized by news of more welcome changes to come. Mr. Speaker, airlift and hotel capacity have not yet returned to pre-pandemic levels. Hotel inventory has proven to be a limiting factor in the island's bid to restore air capacity. So the growth of our hotel bed count is a pressing need for tourism's recovery. It is a challenging environment. However, there are some promising developments on the hotel front. Azura Hotel has announced that it will complete its final phase of construction this fall, and that its second property, Nautilus, is progressing well with a sold-out Phase 1 and hotel opening slated for 2024. The Bermudiana Beach Hotel, a Tapestry resort by Hilton, is set to add 110 much-needed hotel rooms into the inventory in 2023. Likewise, Rosen Hotel, which has developed an award-winning sustainable farm-to-table culinary model at the property's restaurant, will reopen its boutique hotel next year with 12 luxury rooms. Cambridge Beaches has invested in renovations to the property and the opening of new food and beverage outlets. Mr. Speaker, the Fairmont Southampton deal continues to move towards finalization, with all parties working through final documentation in the knowledge that this redevelopment represents the single most important game changer on so many fronts in tourism. Mr. Speaker, the Bermuda Tourism Authority cites local engagement as a key pillar of the country's national tourism plan. This summer, the Lauren Hotel resurrected its annual Celebrity Chef Summer Culinary Series. The South Shore property featured Ghanaian-American celebrity chef Eric Ejapong and Chef Tiffany Derry for fully subscribed culinary experiences for our visitors by incorporating a community engagement component. In partnership with the team at the BTA, the Lauren and the world-famous chefs created intimate learning experience with young Bermudians interested in a career in the culinary arts. Chef Eric hosted a chopped-style experience for a dozen young boys aged 13 to 18. These young men were from the Bermuda Government Summer Day Camp programs and were introduced to the basics of food preparation, presented with a mystery basket of ingredients, and instructed to collaborate with their fellow participants to produce a dish using the available tools and ingredients. Similarly, Chef Tiffany Derry spent an afternoon sharing the joys of a career in the culinary arts with a group of young women from summer camps around the island. I wish to thank the team at the Lauren for creating an opportunity to show the potential of a career in hospitality. Mr. Speaker, on World Tourism Day, the BTA celebrated sustainability with the theme Rethink Tourism. The authority launched a supporting social campaign recognizing faces in tourism outside the traditional realm whose work contributed to sustainability and an eco-conscious approach to hospitality. The Bermuda public can expect more communications that will showcase unexpected ways that locals can engage and participate in the tourism sector in alignment with the National Tourism Plan. Mr. Speaker, the organization's maritime strategy has already exceeded 2022 targets as of August. A critical component of our maritime strategy has been the growth of the superyacht segment. The strategic integrated marketing partnerships initiated in 2021 have positioned Bermuda to make significant inroads in increasing awareness and engagement with the superyacht industry. Since 2020, Bermuda's focus on attracting superyachts has created opportunities for growth. Bermuda has welcomed 79 superyacht calls to date in 2022, compared to 37 in 2021. Superyachts can have, can have a significant impact on any local economy with expenditure on berthing, fuel, maintenance, and supplies, as well as onshore spending by crew and guests. Through August 2022, $3.0 million, $1.1 million in 2021, in economic impact has been realized from superyachts in Bermuda. Mr. Speaker, historically, Bermuda's entertainment sector has always represented an exciting, memorable part of Bermuda's tourism product. The BTA has made 2022 the starting point for revitalizing and investing in Bermuda's entertainment product. The government collaborated with the authority to invite tourism entrepreneurs and promoters to provide unique, culturally authentic entertainment experiences. The Great Sound Entertainment Series was launched in August, featuring local entertainment showcases, including a revival of the popular Made in Bermuda Nights series. Bermuda's entertainers, whose livelihoods were adversely impacted by COVID-induced lockdowns, restrictions, and the drop in visitor arrivals, are finally beginning to see more opportunities. Mr. Speaker, with the BTA-sponsored events and grant programs for qualified experiences, this administration is committed to providing a boost to local entertainment. We salute the local promoters and business owners for their role in creating opportunities to enjoy Bermuda's culture with weekly musical lineups around the island. Mr. Speaker, the government is proud of the support it has provided for live entertainment through the Great Sound Entertainment Series. The Saturdays at Woody series wrapped up last weekend with a stellar performance by one of Bermuda's most prolific creators of original Bermudian music, Original Live Wires, and the Kings Band. The series included performances by some of our most talented bands, including Hindsight, Working Title, Paradise Band, and more. This weekend, the Great Sound Entertainment Series concludes with the inaugural Swizzle Festival in Bars Bay Park. The Bermuda Tourism Authority has launched a high-impact, visually appealing brand campaign titled Lost Yet Found. The campaign leverages themes of authenticity and curiosity that shifts the narrative about who and what Bermuda is. The creative strategy was developed based on industry data and targeted research identifying specific decision-making drivers for the country's target visitor. They will be using all media platforms to tell and share stories about the breadth and depth of Bermuda and her people. Bermuda's new advertising campaign is live in households around the world and has already had 5.2 million views due to strategic advertising placements. The campaign is ongoing, and early performance numbers are outperforming historical brand performance metrics. The BTA has created a mobile booth experience that will draw in prospective Bermuda visitors that will launch towards the end of this month in highly visible locations in Miami, New York, and Boston. Lastly, Bermuda will launch an in-airport campaign targeting holiday travelers in Philadelphia and Charlotte. The campaign is a data-driven tool to entice visitors to the island. That is why the BTA's marketing includes ongoing study and analysis of the campaign impact and reach, including tools to also measure overall consumer sentiment toward the campaign. The distribution report for the Lost Yet Found announcement, which led with the headline, Bermuda's Lost Yet Found campaign lures visitors for a deep dive into the destination's unique culture, was well received and had a combined audience of 89.5 million through 110 pieces of coverage to date. Mr. Speaker, our people will be the engine driving the revitalization of tourism in Bermuda. And the team at the Bermuda Tourism Authority has been aggressively focused on that aim. The organization has been restructured to achieve the goals of the Tourism Strategic Recovery Plan. And under Ms. Barkley's leadership, the authority has made progress on staffing gaps with the appointment and promotion of qualified, experienced professionals to several key posts in the marketing and sales divisions. Mr. Speaker, after a robust calendar of events in July, August, and September that saw entertainment, sporting, and group events, as well as a rebound in leisure, business, and wedding travel, Bermuda will see a solid calendar for the next few months as part of our strategy to attract year-round visitation. Building year-round business is a vital part of the National Tourism Plan and is key to attracting and retaining an engaged workforce, driving visitor spending, and building the case for more airlift year-round. The BTA supports sporting, culinary, entertainment, group, and cultural events, which will either attract visitors or entertain those already on the island. The calendar is built out through a combination of BTA-led, BTA-sponsored events, and existing on-island events that the authority promotes on its channels. Mr. Speaker, October began with the City of Hamilton's hugely successful Taste of Bermuda event and the finale of the government-supported Great Sound Entertainment Series. It continues with the Department of Community and Culture's Bermuda International Gumbe Festival. Sports events such as the Rugby World Classic, the PGA Tour, Butterfield Bermuda Championship, APGA Tournament, and the PGA Magazine Lyles Foundation event, and the Bermuda International Gig Championship are expected to attract hundreds of visitors to Bermuda for a post-summer boost in visitor arrivals. The Bermuda Festival of the Performing Arts returns on November 4th, and Dame Flora Duffy returns to compete on home soil for the World Triathlon Series. The Lauren Hotel will be hosting a culinary festival and the Food Harvest Journey, which celebrates Bermuda's culinary heritage and highlights Bermudian artisans, farmers, fishers, and local food stars. Bermuda is invited to the BTA Tourism Summit on November 18th, which will be an opportunity for tourism stakeholders to come together with the Bermuda Tourism Authority to explore the future of tourism in Bermuda, learn about upcoming initiatives, get training, and network with industry players. Mr. Speaker, we are at a critical juncture in our efforts to reverse losses incurred by the pandemic. The Bermuda Tourism Strategic Recovery Plan has been the guiding document for the men and women of the authority who work each day to restore the industry. Rebuilding the tourism sector is a non-negotiable exercise, and the BTA team is committed to the effort. I would like to encourage those who have just joined the sector and those who have been serving in critical roles on the tourism front lines and the back of the house for many years to continue in this effort to renew tourism for Bermuda. Mr. Speaker, I would like to commend the resourcefulness of all who have played a part in keeping this essential industry on the path to recovery. In closing, Mr. Speaker, I would like to salute the dedicated BTA staff, board of directors, and their industry partners who work diligently towards the success of this country's vital economic pillar. I encourage everyone to lend your support to the work being done to rebuild this critical economic sector. Thank you, Mr. Speaker.
Thank you, Minister. That brings us, members, to the end of the ministerial statements. We now move on to the reports of committees. There are none. Brings us to the question period. This morning, we have questions from the statements that have been were given this morning, and we'll note the time for it and start our 60 minutes. The first question this morning is on the statement from the Deputy Premier. Deputy Premier, the opposition whip has a question for you.
Thank you, Mr. Speaker. Good morning, Mr. Speaker, honorable colleagues, and the listening public. Would the honorable minister please explain the mechanism used by the Registrar General to determine current resident population? Thank you.
Thank you, Mr. Speaker. The registrar confers with the Statistics Department, in addition, clearly taking into account the births and deaths that will be reported to the registrar to take account of the births and deaths, and ultimately coming to an estimation that is on population numbers.
Thank you. Supplementary?
None. Thank you, Mr. Speaker.
New question?
None. Thank you.
Okay, thank you. That brings us to a close for the questions on your statement, Minister. The next statement that has questions this morning is that for the Minister of Education. Minister, the opposition leader would like to put a question to you.
Thank you, Mr. Speaker. I'd like to begin by thanking the Minister for the work that he's done so far on the signature schools. My question to the Minister is this. Can the Minister provide details on the curriculum alignment from the middle school to the senior schools in regards to the signature programs, and that they're so specialized, and we would want there be some type of alignment so that the students transferring or transitioning from middle school are qualified to do some of these subjects?
Thank you, Mr. Speaker, and thank you for that question. It is actually very topical. For the initial group that has entered S1 students, a program developed, that program was developed called the Taster Program. The Taster Program is a program in which the students are exposed to the particular signatures. They're given various counseling preferences, and it's not just them that are exposed, it's their parents as well as the teachers. And so they're in a better position to decide which signature more suits their aptitudes and their likes. The incoming M3 students will begin that taster program this month, with the the M2 students beginning the taster program in January of next year.
Entry.
Thank you.
Yes, okay.
What support does the ministry give S1 students, the new S1 students who actually enter and choose a signature school program, but yet they don't have the prerequisite skills to actually enter, like the finance or veterinary or banking and finance programs, even though they're attracted to it, they may not have the prerequisite skills. So what support has the ministry given to those children to bring their skills up to the level that will enable them to qualify to go into some of these signature programs?
Minister?
Mr. Speaker, thank you. Again, thank you for that question. And I appreciate those questions coming, because this particular question has been answered dozens of times in the various public presentations that we do give on education. Unfortunately, and I'm not playing politics, I do send these notices to the opposition, and unfortunately, they do not show up to any of these briefings. Mr. Speaker, the signature programs are a 4-year program. Currently, they will convert into a 5-year program. The first year is what we call introduction into the various programs. This gives these students an opportunity to see if this is exactly what it is they want to do. It is an introduction. When you think of it as college, they're doing 101 classes that that are just give them tasters of what's going to be coming, what's going to be the beginning of what's going to be the beginning of moving forward. So, for example, you take the the opposition leader did speak specifically of finance, the finance one. I spoke to several signature programs that are across the finance signature. However, in year one, what the students take is identical across, because it's an introduction to all of this. There are different courses that will the courses given during that first year are courses that are applicable to all students that are entering into those particular signatures. When we get to Cedar Bridge and we're talking about trades and professions, it's slightly different, because when you talk about trades and professions, what you're learning initially that gets you interested in carpentry is slightly different from what you would use if you're getting into culinary arts. And so all of those first year courses are very introductory courses to give students an opportunity to see if that's really where they want to go. One of the questions, and I know I just want to expand on this, one of the questions that we continuously ask is, well, what if my child doesn't like and they want to switch? And that is quite possible. They will be able to switch. They will even be able to switch schools if there's space at the other school that we are looking at. I also think it's really important to point out that the signature program part makes up 30% of the students' time in school. 70% is on the regular curriculum, the math, the science, the social science, and the English language subjects, which is our core, what we call our core curriculum. And then you have the on-core stuff, which would be art, drama, dance, and the physical education and different things like that. So they'll be given the core curriculum, the on-core curriculum, and then the signature programs will make up around 30% of a maximum of 30% of what it is they're doing through their school career.
Thank you. Is it supplementary? Second question? Go right ahead.
Mike.
The minister indicated that the teachers were all welcoming and so on, and I saw that myself, and I was just alarmed to see today's newspaper in regards to teachers not being paid on time. Can you speak to that, please?
Minister?
Mr. Speaker, even though the mention of the statement didn't speak anything about teacher salaries, I do believe it's a topical question, and I was shocked to see that in the newspaper myself this morning. This morning, actually, that story was printed last night. I immediately asked immediately reached out to the Royal Gazette, because we received an email for comment at 6:14 p.m. the story went live 6:43 p.m. And at the bottom of it, it said, reached out to ministry for comment, which I find, quite interesting. So I reached out and it said, I won't go into what the response from the Royal Gazette was, but I was less than pleased to hear what the response was on why you asked for a comment and then print the story literally 20 minutes later. But, Mr. Speaker, I've asked my team for an explanation of what has happened there, because I do know that the letter that, unfortunately, the letter that the Bermuda Union of Teachers forwarded to the press was a letter that had been received on the 30th, last week Friday, and it had been responded to by the 3rd of October, stating that, yes, there had been an error, and I'm trying to find out what that error was, that there was an error in processing payments, but all teachers would be paid by the end of the first week in October. That's exactly what the response to the Bermuda Union of Teachers was. So I was very surprised to see that appear in the newspaper, but I've asked my team to look into it so they can get me some further answers of exactly what happened there.
Supplementary?
I would like to thank the minister for his comments.
Supplementary or?
Yes, it's supplementary. So can he confirm that this is a reoccurring problem from year to year, and why it could not have been addressed during the summer period?
Minister?
Mr. Speaker, from my understanding, the bulk of these errors stem from paperwork not being submitted by the employer on time. However, as I stated, I've asked the team for a complete update of what exactly happened. I do know when this particular email or this particular letter was responded to, I asked what was the problem, and that was the answer given, that the bulk of the persons who were unable to be processed had not submitted some relevant paperwork in time to the Bermuda government, so that payment could be processed. But it had been sorted, and those payments would have occurred by the end of the first week in October, which actually would be today.
Supplementary?
Yes, the supplementary is this the first time that it's happened?
Minister?
The simple answer to that is no, and as I answered, I thought I answered, but maybe it didn't come across that this happened last year, and the rationale given last year was we're waiting for employees to submit paperwork so we can make the payments. And so, again, I saw the email that came, and I was made apprised that it came in and the reply that had been sent back, and that's how I know what was actually said. The minister doesn't write checks for employees to be paid, but I asked questions of the technical officers of what happened, and the answer that did come back was from what they could see, it was some particular bits and pieces of paperwork they hadn't received yet for payroll.
Third question?
My second supplemental?
Done two supplementals.
Okay, my third question. Can the minister make a commitment that his ministry will ensure that this will not happen again going forward?
Minister?
Thank you, Mr. Speaker. What I can make a commitment to do is ensure that the request for paperwork is submitted on time, so the payments can be made on time.
Okay. Done? Okay. Thank you, Opposition Leader. Minister, you have further questions? The next question this morning is from MP Famous. MP, would you like to put your question?
Good morning, Mr. Speaker. Good morning to the listening public. Minister, I have several young relatives and constituents with children in M3. Can you tell us what is being done to guide them to the proper choice in signature school, please?
Minister? Thank you for that question. I spoke to it earlier, but I will speak to it again because it's important that persons know exactly what's going on. We've developed what we call a taster program, which gives an overview of all of the signature programs, all of the signatures and the signature programs that fall under those signatures. Those programs are administered last year they were administered to the M3s. This year they will be administered to the M3s and the M2s as we move forward. However, I must speak to the totality of our education reform, and that is when we remove the middle school, phase the middle schools out and return to a primary and senior school setup, that those taster programs will be baked into the curriculum at the primary school level. So students will not just get taster programs where they're being told this is what it's going to be and show examples of what it's going to be. There will be actually baked into the curriculum that they will learn as they enter into P7 and P8 prior to them going on to S1 in senior school. Thank you.
Supplementary?
Yes, Mr. Speaker. Minister, can you tell us how many persons have been involved in these taster programs so far?
The taster programs are involved the M3 students. As I stated in my statement, we have nearly 300 M3 students that have gone on to S1, so it would be 300. Currently now, I don't have the exact figures in front of me, but we're looking at around 90 students at Whitney, 90 students at Delwood, probably around 80 students at Sand Secondary, and more around 30 students when we're talking about the M3 students at Clearwater. I would have to, I can get to that, remember the exact numbers of the students. And then when you add in the parents and the teachers, so you're looking at well over 500, between 500, around 500 people that will be exposed to those programs. Not also withstanding, the taster programs are, we put them online for anyone else to look at them, because what we do realize is we will only reach our public school students, we won't reach our private school students. I'm happy to say that I did run into some private school students who had come back after looking at the taster programs at the various schools when I was there welcoming the new students in.
Thank you. Supplementary?
No, Mr. Speaker, thank you.
Minister, the next member who has a question for you is MP Jackson. MP Jackson, would you like to put your question?
Good morning, Mr. Speaker. Actually, many of my questions have been answered previously, but I do have one other question, and that is what the minister might be preparing in the form of a contingency plan to make sure that the communication and relations between those teachers and stakeholders who are providing support to the students, to make sure that we will have as close to an uninterrupted school year as possible. So what contingency plans are being put in place to make sure those relationships remain healthy?
Minister?
Thank you for that question. It is critically important that what we're doing is transforming a system and running a system and running the current system at the same time. So it's always a struggle to find persons to come out of the classroom and to volunteer their time to do the work necessary to what we call co-develop, what we're moving forward with. So we use very creative mechanisms. Teachers are volunteering their prep time that they wouldn't normally be in classroom and after hours time to help with moving this forward. We meet on a continual basis with our community partners, with parents, and we try our very best to be as least disruptive to the school operations as much as possible. It's a massive amount of coordination that is going on. And what we've learned, now that we've opened our signature schools and we're starting to work on the primary schools, we're looking at how we can do this differently. And one of the things that we're looking to pull together is a permanent team that is pulled out of the classroom or out of the department. And so they're working on this on a permanent basis versus someone who's who's in class, but might be in class 3 days a week, but not those other days. And so we can have some consistency in the classroom and some consistency at the department, while we also have consistency with the work that needs to move forward. In terms of a communications plan, the whole development of education reform, if you look at, we have a almost 90-page thick communications plan that we've worked on that actually takes us month by month as we develop the different things, where we're going out, how we're interacting with the public. As you heard me talk about the pop-ups that have been going on, that is part of what we call the socialization communications, where we're going to the public instead of asking them to come to us. So we've had setups at Nelly's Walk, we've had setups at Kroll Gas Station, Linda's. We even had one at outside of Spinning Wheel last night. We've had them at the Bermuda College and at Cedar Bridge and at various other points where they're set up to, and the purpose of them is the general public can come and just ask any questions they want, give suggestions, because that is how we're doing this collaboratively. I do want to thank, I was made aware that the opposition whip stopped by one of our pop-ups outside of Nelly's Walk earlier this week. So it is working, and we're getting some really good feedback from the public on what they perceive, what they know, what they don't know, and it gives us that opportunity to get out there to them versus setting up something and them saying, please show up, on your convenience or, when you're on your way to work. So we're really working hard to get that, to make sure that communications part is there.
Supplementary?
Yes, Mr. Speaker, thank you. Having heard that most fulsome commitment to the signature programs and the work that will be carried out throughout the year to make sure that there's continuity and that learning continues, et cetera. But my question was really focused on the support, making sure that there is attention and priority or equal balance given to the teachers and the support staff who are making this new school reform work, and making sure that they receive the continuity of services in the form of payment, in the form of their benefits, et cetera. There was so much discussion about this last year, and I just want to make sure that as we enter this new school year, that we are prioritizing our teachers and support staff. And so I'm really just asking what is being done to make sure that the services are provided to our teachers to make sure that we will have an uninterrupted school year.
Minister?
Thank you, Mr. Speaker. I'm hoping I'm able to answer it this way because I've not quite understood that last part about the continuity of our school year. We did take a look. One of the things that we've done is consistently look at how things are being done and how they're being accomplished and how we can do things better. The team spent this summer developing what a stipend package would look like for all persons working within on education reform, because we realize it's only so much that you can ask persons to do out of their personal time to come and continuously give and not give back. So there is a stipend package that has been put together that we will be starting to apply for persons that are that are providing the services that we need in order to co-design and move our system forward. So I'm hoping that's the answer you're looking for. But we have budgeted for, we found money, we've done all the way we need to do, and we believe it's a very attractive stipend that will be given to as a way of saying thank you for your extra time that you're spending.
Thank you. Supplementary?
My final supplementary.
Yep.
Thank you, Mr. Speaker. So my final question really is that having stipends and making special arrangements to make sure that teachers and sports staff are being recognized, but I also have to ask whether the actual framework, the systems, the communication with the unions are all in place so that there is a clear understanding that any stipends, regular salaries, et cetera, will be paid, and that there will be continuity of service to provide the teachers with what they need so that they're happy and going to work every day to give the best they can for our students.
Minister?
Thank you, Mr. Speaker. Again, I'm not quite understanding the question. All of our teachers are contracted teachers. They receive a regular salary no matter what. As long as they come to school, do what they're supposed to do, and teach. When I was speaking of the stipend, this is for the extra work, which they do, which is voluntary. We have people that come in and come out who say, I just can't do this anymore. I just don't have the time. I'm sticking to my regular school work, or others who say I can take on more. And so the stipends that we're talking about is in addition to the pay that they already have. So that's already there. We cannot not pay, although we heard there were some issues with teachers at the beginning, and these were mostly, from my understanding, new teachers or substitute teachers. But the teachers already are salaried individuals that receive their pay on a monthly basis, however it is that they do get paid. And the stipends that we're referring to is additional for additional work that they do. And so for that in mind, yes, the budget is there to pay all of the salaries of the teachers, the principals, the support staff, and everything, because that's what we have to do.
Thank you. No further questions, right? Minister, other members still have questions for you. MP Wade, I believe you have questions for the minister.
Thank you, Mr. Speaker.
Morning.
As many of you know, I'm the chair of the Cedar Bridge Academy Board of Governors, so I've been intimately involved with this process. Minister, would you be able to give our colleagues and the listening public an estimate of what time commitment was required of those participating in the necessary planning to get to the point that we're at?
Minister?
Thank you, MP Wade, for that question.
MP, one sec, have a seat while the other members on the seat.
It is.
You could have said it that one with the mic, yes, but yeah.
It is actually quite difficult to quantify the exact number of hours each person has put into this. People have come and given much more than others. Some people have come to seminars and given, and sat in seminars and given their particular thoughts and perhaps not come back. There are others that have been there every single time and not come back. So let me just take you through some of the things that did have to happen. We welcome anybody who comes and wants to give. We've always said what we really want is the people who are the naysayers, because those are the ones that will really give us insight. We don't want the people who are already singing from the same hymn sheet. But this journey began in 2020, as you heard me say earlier, some 30 months ago. And it began with initially putting out notices of interest to people to come in. And before you could get put on a team, there were various interview processes that went through. I do understand it was around 45 minutes per interview, and they actually interviewed hundreds of persons for that before they whittled down to the final. I believe it was around 130 persons that moved forward with that. After that became the research required to develop what we call the future World of Works document that we did. That document was something that not only talked to our teachers, our parents, our students on what it is they want to, that is also talking to industry of what it is that Bermuda will need to thrive, not just today, but 5, 10, 15, 20 years from now. And so that document is a living document, and it can be accessed by anyone on the learningfirstbda.com website, and that gives an understanding of what Bermuda is doing in terms of employment needs. That was a document that took around 6 months to pull together. The next was the requirement of the consultation and engagement of taking that document and converting it into what would be the final 10 signatures. And I think it's important that I talk about the final 10 signatures, because that document also, when we came from that document, there was 11 signatures, with entrepreneurial being an actual signature. Once we developed those, we went back and did more consultation, more discussion, more talking, and that's where entrepreneurial fell away. And it actually was written to be included in the curriculum that will be eventually developed, going all the way from primary through high school, because it was deemed that important to have that based in the curriculum and everything that we learn based on that, versus having it as a separate entity. So that was another process that took probably around 6 to 7 months. The next part of that was pulling together the teams to talk about how we will develop what will be taught in the classroom. Those were I believe there were around 23 work streams that went along with that, and that developed the various bits and pieces of what happened in the classroom. That was work being done externally, talking to the public. That was work being done inside of the schools. And so that was ended up being for the time it took place, that was meeting a minimum of twice a week, and then sometimes in the evenings to speak to what my honorable colleague Jackson talked about, to prevent any sort of disruption, or as least disruption as possible within the school term. And so when I add that up, and when I talk to when we talk about this, and we really try to put our heads around this, we estimate that anyone who was in this from the beginning to the end for the full term had spent just shy of 600 hours working on this outside of their regular work. And when you factor in what 600 hours means, you're talking about the commitment you would put into actually pursuing a postgraduate degree, 600 hours of work. And the work was done in such fidelity that everyone can appreciate it. And this is why we hear from persons that, we really get this, and we really understand this, and we really want to be a part of it. And this is how we continue to get people to want to come on and be with us. Thank you, Mr. Speaker.
Thank you. Minister, supplementary?
No, Mr. Speaker.
Thank you. Minister, the next member has questions for you this morning is the opposition whip. Member, would you like to put your question?
Thank you. Thank you, Mr. Speaker. Would the Honorable Minister please clarify to this Honorable House the state of the development of the existing signature programs. That is, that some 289 S1 students are now currently in the signatures of financial and insurance services, health and social care, science, technology, engineering, and math, trades, and profession learning. Would you please clarify the statement on page 4 that the work at the S2 and S3 levels is not yet completed?
Minister?
Yes, Mr. Speaker, as I've stated, the signature program is for the incoming S1 students. The bulk of the work that has taken place over the previous year was to get the S1 program up and running. We are currently now developing what S2 and S3 would look like. So they're in place for S2 being in place for 2023, S4 being in place for, S3 being in place for 2024.
Supplementary?
Yes, thank you, Mr. Speaker. Would the Honorable Minister be able to tell us if there is any backup plans in case the development isn't implemented in time?
Thank you.
Thank
Minister?
you, Mr. Speaker. I can confidently state there is no backup plan because that is the plan, and it will be in place come 2023.
Second sub?
Second sub, would the Honorable Minister be able to outline what are the steps required for the S2 and S3 levels to be brought online?
Minister?
Thank you, Mr. Speaker. During the development of the S1 phase, the S2 and S3 were looked at, and so it's what it is. The development of these particular programs doesn't happen overnight. It requires the looking at of curriculum, development of curriculum, the tweaking of curriculum. In some cases, we can get curriculum off the shelf. In some cases, we develop it ourselves. As we talk about this being for Bermuda, by Bermuda, it just takes that time to take what it is that we have and convert it and make sure that it's authentically specialized for Bermuda. And so, as I said, in some cases we get it and it's like, wow, we can utilize it just as it is. In other cases, it has to be tweaked. Teams are working on that, and we're confident based on the schedule we have and the schedule and the milestones that we are hitting that it will be in place by the time we get to 2023. In fact, it will be finished before we get to the beginning of the school year. So we'll know well ahead of time if there is any additional work that needs to be done to get it ready.
Thank you. Second question?
Yes, thank you, Mr. Speaker.
Go ahead.
Would the Honorable Minister be able to explain when a student completes the S3 level, will they have professional qualifications? My question relates specifically to the trades and professional learning signature at Cedar Bridge Academy.
Thank you, Mr. Speaker. Mr. Speaker, the purpose of the signature programs is that our students, when they leave our schools, and it will not stop at S3, there's still S4 and then S5 to be developed as well. But when our students leave our schools, they'll not only leave with what we call a signature school diploma. That signature school diploma will contain additional credits from what they would have normally earned if they went through the regular track. And those credits are based around specific milestones that they will hit within their particular signatures. The purpose of this is to give our students the opportunity that once they leave our school system, they are ready for the workforce or they're ready to go into tertiary education. That includes having any sorts of credentials that go along with those particular programs, whether they be internationally recognized credentials or locally recognized credentials, whether there be internships. And one other thing that is kind of special about this is something we developed called externships. These are programs for our teachers as well to go out in industry and actually learn what happens in industry. Because when you have a teacher that's teaching math, for instance, math at an insurance company is slightly different from just a regular math you would have in a regular classroom. So that's part of this as well. So the short answer to your question is yes, they will have qualifications that they'll be able to carry with them and say, yes, I have done this. But the qualification will actually depend on what it is that they're doing. So as you talked about with trades, there's city and guilds that's already being worked on types of qualifications that they'll be able to get. But when you're talking about finance, or it's like accounting, we're talking to ACCA, to bring in ACCA, so our students, when they're looking at finishing high school, they'll already have credits towards gaining their qualifications in an ACCA type path. So there are different things for different ones. I can't speak to every single one of them, but that is the idea, to continuously develop our programs on a continual basis. So what we develop today and what we're talking about today, 5 years from now, might be different, because it will be always be looking at what's happening in industry and what industry needs.
Supplementary?
No, thank you, Mr. Speaker. Third question.
Third question, go right ahead.
Thank the Minister for his answers. Would the Honorable Minister please explain any impact or anticipated impacts we'll see to Bermuda College enrollment or their PACE program as it relates to the development of the signature school programs?
Minister?
Thank you, Mr. Speaker. And speaking specifically of the PACE program, the PACE program is for adults. The entry age for the Bermuda College, unless you're participating in a dual enrollment, is 18 years. They make special provisions for persons who may leave high school early on an individual basis, but I cannot see the work that we're doing at the high school level impacting the work that is put in place almost exclusively for adults who wish to go to the Bermuda College and update their skills. So I don't anticipate much impact on the Bermuda College at all.
Supplementary?
None, thank you, Mr. Speaker.
Thank you. Minister, there's one other member who's indicated they have questions, and that's MP Adams. MP Adams would like to put your question.
Thank you, Mr. Speaker. I first want to join the opposition leader in commending the minister and his team for the work that they have done in this with this signature school. But Minister, you speak to external partners being involved all the time with the reform efforts. Can you give examples of who has worked alongside the ministry to get us to this point?
Thank you, MP Adams, for that. It is critically important for our signature programs to have partnerships with external partners in order for them to continuously give us ideas on what our children need to learn. What we're looking to do is sign MOUs with these partners, so there is an understanding of what they'll be providing for us and what we need to provide for them. I can state that we are in the process of, we have draft MOUs in place for BIOS, BUEI, and BAMS, and BAMS at the moment that is being vetted. Other companies that we're in discussions with for MOUs is companies such as KPMG, EY, First Class Electrical, and virtually all of the government departments as well as we move forward. We've had also some conversations with Arizona State University and looking to sign some programs with them. They're keenly interested in doing some work, not only with the Bermuda College here, but also with our public school students as well. And so that is looking quite promising. And I just want to say thank you to the U.S. Consulate General for helping to facilitate some of those conversations with Arizona State University.
Thank you, Minister. Supplementary?
Yes, Mr. Speaker, just a little bit of asking the minister to give a bit of clarity as to how some of the students are involved in that process.
Minister?
Yes, the students would be involved. The idea of looking at these companies is to get them to sign on to MOUs to either allow for students to be on their premises to learn, or in some cases, we're looking at them actually sending persons to us that can be in the classroom and teach. And we're looking and working with the BEC on developing a special license for persons that can do that. Persons of industry coming and talking and giving presentations to students in the class is a lot different than a teacher trying to say, well, this is what it's going to be like out there. So that's how the students get involved. They either will be on some of these sites, and as I spoke earlier, depending on their signature, will require them to be on the site learning things, but also for them to send us people that can actually speak to the students as a de facto teacher in front of the class.
Supplementary?
No, that's it for me, thanks.
Okay. Minister, that's the close of questions for you this morning. Thank you. Members, we now move on to the next statement this morning. Minister of Health, you have a statement from MP Pyramid. MP Pyramid, would you like to put your statement?
Thank you, Mr. Speaker. My thanks to the Honorable and Learned Minister for her statement to the House about health today. Honorable Minister, at page 2 of your statement, you make this alarming statement that, quote, Bermuda has one of the highest per capita health expenditures globally, but our population health outcomes do not reflect this. My question to the Honorable Minister is, what do you think is the primary cause of that issue?
Minister?
Thank you to my honorable and learned friend for that question. Regrettably, I think the primary cause with respect to our highest per capita health expenditure, as well as our health outcomes, is the fact that people don't control what they eat. It's a matter of inactivity. It's a matter of lifestyle choices. We have 3 out of 4 individuals of adult age are either overweight or obese. 50% of our adults have a chronic condition, have chronic health conditions. Unfortunately, we are living longer, but we are living sicker. So we do have a very unhealthy population, which of course increases health costs due to utilization and the like. We spend over $770 million a year on our health costs. And when you look at those figures compared to the regrettable physical condition of our adult population, as well as our children, because we are seeing increases of obesity within our children, the two don't manner up. So it is twofold. One is the lack of personal choice and personal responsibility as it relates to taking care of our own health, and then that obviously adds up to utilization, and the costs continue to grow because of that.
First supplemental.
Yes.
Thank you. Other than obesity, as you've just identified, what specific outcomes that you refer to in your statement are falling short?
Thank you. Specifically, we're speaking about chronic diseases, in particular hypertension, diabetes, and the like. Again, many of those chronic conditions regrettably are as a direct result of lifestyle choices. So again, the statistics are really, really sobering, and the chronic diseases that we are seeing in this particular population are very, very alarming.
Second supplemental.
Yes, go ahead.
Thank you. You've announced a national digital health strategy to tackle this. What is the budget for that strategy, and is it on budget?
Minister?
With respect to the budget, I don't have that information. It's all part of the rollout of universal health coverage insofar as any type of budgetary items as it relates to technology. That will obviously be budgeted within the health ministry, and we'll bring that to Parliament. But right now, the committee has just started meeting, and they're looking at ways of which they can use technology, for example, to help to foster better health outcomes, efficiencies of scale, and so forth. So it's a working group. As I indicated in the roadmap, when I first announced the roadmap last year, there are a number of working groups. One of them in particular is the working group that deals with the national health strategy. So what they'll look at is, from a strategy point of view nationally, what kind of use do we have for technology and the like to provide economies and efficiencies of scale.
Second question, Mr. Speaker.
Go right ahead, member.
Thank you. Honorable Minister, page 3 of your statement, you introduced the concept of, quote, super users. How is, and that's in reference to people who are overusing the hospital services. How is a super user measured? Is there any number of attendances or threshold?
Thank you, Honorable. And learned member.
Go ahead, Minister.
Learned member for your question. Dr. Ocarini. Thank you for that question. Dr. Ocarini has been studying the amount of individuals that do attend to the hospital, as well as the reasons why they're attending to the hospital. And as you'll see from page 3, those numbers are very dire.
Just one sec, Minister. MP Terrell, could you come sit in the chair for me for a minute?
So they have been measured. So there are, as it's indicated, some 50 super users, and when they do come into admissions, they monitor what the reason is of their admission, as well as the services that are being provided. So that data was very critical for them to be able to produce this particular report that's evidence in page 3.
Thank you, Honorable Minister. My question was how it was measured. If you could address that, and I'll pose my supplemental with your leave, Mr. Speaker. What is proposed by the government to solve the issue of super users?
Mr. Chair, I do not know specifically how Dr. Ocarini conducted the survey and how he measured the results, but I will undertake to get that information and provide it to my honorable and learned friend. One of the things that we have spoken about previously in this House is how we look at as we continue to explore how to roll out universal health care. One of the things that has to be considered in the package is preventative care. If individuals don't have preventative care, then they can't attend for a doctor's appointment, et cetera, to make sure that they take control of their health. These individuals that we're speaking about, regrettably, are not even having preventative care. They're using the hospital as their preventative care. So rather than going to a doctor to have their blood pressure monitored, et cetera, they're going to the hospital to have that, which, as we all will appreciate, it's far more expensive to provide services through the ER as opposed to going to their general practitioners or alternatively to the health clinic.
Second supplemental. Thank you. I appreciate that you've identified the issue, but what has actually been done to solve this issue to date?
Mr. Chair, as we've indicated, we are in the throes of reviewing and providing for the universal health coverage. One of the items that we've spoken about concerning universal health coverage will be looking at a patient pathway. We'll be looking at the provision of services within a benefits package that will include preventative care. Right now, the standard health benefit does not include preventative care. It's for hospital care and certain diagnostic testing. What we'd like to do eventually when we roll out the pathways as well as a premium packet for universal care is to ensure that it includes preventative care, which is not the case right now.
MP Pearman.
Thank you. My third question, Mr. Speaker, Mr. Acting Speaker. Honorable Minister, at the bottom of page 4 of your statement, you state that the UHC Steering Committee has, quote, just restarted its work. And a moment ago, you said that they've just started meeting. My question is why has that work not been ongoing throughout?
Minister.
With the greatest respect, Mr. Chair, I don't want to seem crass, but it can be answered in one word: COVID. The team at the Ministry of Health that is charged with assisting driving universal health coverage forward have been otherwise engaged for the last 2.5 years in a pandemic. Now that the pandemic it's still here, but now that we're rolling back and we're starting to progress other initiatives, this is one of the initiatives, and it's a platform and a throne speech initiative from the government to universal health care. But regrettably, we've been otherwise engaged over the last 2.5 years with other more important and pressing issues.
Thank you.
First
Supplementary.
supplemental. Yes. When did the work of the committee restart?
Minister.
I believe when I don't have the exact date, but I believe in the beginning of the year, we started having more meetings with the stakeholder groups, and the Universal Stakeholder Committee started meeting, I think, in the new year, in January, and then they started meeting at that point. Many of the subcommittees, as I've indicated here, are just being formed as we speak. We've been able to engage the services of KPMG, who are actually helping to drive this particular reform, and I can assure members of the public, not only will I continue to keep members abreast of the developments, but the team is working very, very hard. It's very similar and akin to what Minister Diallo spoke about earlier. There are a number of stakeholder groups that are volunteers that are also participating. However, the reality of the situation is that there were otherwise events that unfortunately interfered with the progress heretofore.
Second supplementary.
Second supplementary and final. Thank you, Honorable Minister. Notwithstanding your response in relation to why, are you concerned by the lack of progress on this point to date?
Minister.
I'm sorry, Mr. Chair. Mr. Chair, I don't think concern would be a proper word. I would have liked to have seen more progress heretofore, but I'm also cognizant of the fact that that same team within the Ministry of Health, as well as doctors and other stakeholders that are part of the medical profession, have been otherwise engaged in helping Bermuda address and steer through a pandemic. Many of the doctors and the medical professionals that are now engaged as stakeholders in the clinical senate and the like were using their time to assist Bermuda get through the pandemic by either volunteering at the vaccination clinics, alternatively doing testing and the like. The majority of those individuals are now scaling back on their COVID participation for obvious reasons, and the reality is we will now move ahead, full steam ahead.
Thank you. That brings us to the end of your.
Clarification, if the minister will take it, Mr. Speaker.
Minister, you accept the
Will you accept
clarification?
one of our, just on the super users, are those insured or uninsured, or do we not know?
The majority of those super users, Mr. Chair, are uninsured.
Thank you, Minister. That brings us
Thank you.
to the end of the questions of that statement. We'll now move on to the statement from the Minister of Works. You have a question from the MP Cannoneer.
Thank you, and good morning, Acting Speaker. On, I believe it's page 2, I'm not sure exactly the page. There's an initial grant of $4.2 million that is going to be granted towards this particular renovations project. I guess what I wanted to know from the minister is that's just for this initial year as they get up and going. The question is what should we anticipate, since we already know an approximate amount of the renovations? Should we anticipate more grants being given for the following years, considering the numbers?
Minister?
Mr. Speaker, yes, the Cabinet has approved the Hill $21.6 million, as well as out of that will be $4.25 million immediately, and in subsequent years there will be application for the balance of the 21 million.
Supplementary?
Yes, supplemental. Okay, yeah, I'm glad the minister clarified that, because as I read through it, it wasn't quite clear how this was working. So then, I guess my supplementary would be then, considering that there is also, in addition to this improvement of the 21 million, there's also an improvement of 3.2 million for customs duty? Yes, 3.2 million for customs duty. Is that inclusive of the 21 million, or is that something that we're working out as we go along?
Minister?
Mr. Acting Speaker, the 21 million is inclusive of customs duties. So that amount will be reduced by the 3 million that is estimated for customs duties.
Supplementary?
Yeah, second supplementary. So just to be clear then, so then essentially what we're approving then is about 18 million? Is that what the minister's saying?
Minister?
That's correct.
Thank you. You have another question, Mr.?
Yes. Second question. Thank you, Acting Speaker. Just doing some quick calculations. I may have to adjust it now because it's 18 million. I wasn't quite sure of that. First, let me say that Bermuda Hospital, they do a fantastic job, and I've always said that from the beginning. And I'm grateful to the minister for bringing this here, because it is a very important thing considering rents. So I want the minister to know that. I did some quick calculations, and it appears, based on the numbers for the 77 units, with the rent-to-geared income scheme that's in place, which is a very good one, looks about $1,000 per unit, of the 77 units, that the Housing Corporation would probably be looking for if I deduct several of the, the customs duty and the likes, and we're now down to 18,000. I was wondering if the minister actually, does he have an average based on prior rentals of what that rent-to-geared income is bringing in per unit? Is it $1,000? Is it $800? Do we have an average?
Minister?
Mr. Acting Speaker, I don't have that figure at hand, but I'm sure we can get it. But I do want the Shadow Minister to understand that rent geared to income is done on each individual household. So you could have a half a dozen units or 2 bedrooms. Every single one of them is a different rental amount because each household's rent is assessed, and a quarter of that becomes the rent. The other thing that we've noticed in experience in doing this now, particularly during COVID, people were losing their jobs, so there was a reassessment of the household income and adjustment in what their rent then would be.
Thank you. Supplementary?
Yeah, supplemental to that, and I figured that was probably the case, was the case. Does the minister then know, was there, so the rent geared is, what is it, 30-something%, 35%, and then additionally 10% has to be saved? So did they reduce the 35%? Did they do by a percentage? Is that how they reduced it?
Minister.
No, it's by dollar amount. So in other words, if the household income was $4,000 a month, the rent would be $1,000 plus another 10% for savings. If the household income was reduced to $2,000 a month, then the rent would be $500 and 10% of that reduced amount for savings.
No further question. Thank you. I note the speaker had the opposition whip to ask a question on this statement.
Yes, thank you, Mr. Chair. Would the Honorable Minister please clarify a statement on page 2 that 60 of the units being discussed are currently occupied, although they are not in compliance with the building codes?
Minister?
Yes, that's correct. So of the 137 units, 77 of them are vacant, and so there are no occupants. 60 of them have people living in them, but they require renovation. And I'll give you a practical example. We have 40 units at Harmony Club that are partially occupied at the moment. There are 32 of them that are occupied, and there is one building that comprises of 8 units that's under renovation. So we will renovate the 8 units, move, and there is a plan to increase that number by utilizing some of the units in the main building so that we actually get 16 units renovated, so that we can then transition those people that are in the other 2 buildings into one of those units, renovate them, then transition the other folk into the renovated space and have space for 16 new people at the end of this process at Harmony. There are a couple of other properties that fall into the same category that are a lot smaller than Harmony, but that's the basic underlying principle.
Thank you. Supplementary, MP?
No supplementary. Second question, please,
Second
Mr. Chair.
question, go ahead.
Thank you. The Honorable Minister had mentioned, I want to say on page 2 again, that this BHC renovation scheme was mentioned in the throne speech as well as in the economic recovery plan. Can you just clarify that's the case? It's in actually both?
Minister?
This scheme wasn't mentioned in the platform. What was mentioned in the platform was providing affordable housing for Bermudians. So this is a step in meeting that commitment.
Supplementary?
Thank you very much, Mr. Speaker, Mr. Chair. Would the Honorable Minister be able to clarify whether or not these projects would, now, sorry, please disregard, Mr. Chair. Third question.
Okay.
When will the total 137 units be added to the stock? Thank you, Mr. Speaker.
Minister?
Well, let me clarify that we're not adding 137. We're adding 77. There's 60 that are currently occupied. The plan is over the next 3.5 years, and that is with the ability to accelerate if a number of factors are available to us. We expect that with the coming online of the renovations at the Fairmount Southampton, that there will be a race to get contractors to do our work as well as theirs. And we're seeing some of that now in some of the work that we're doing, that contractors are having to juggle 2 or 3 jobs. And so that's the reason for the timeline. If we can accelerate it and get the personnel to do the work, then it'll be in a shorter space of time.
Supplementary?
Yes, thank you, Mr. Speaker. Would the Honorable Minister be able to point out where this scheme fits into the Economic Recovery Plan?
Minister?
Mr. Acting Speaker, I didn't mention the Economic Recovery Plan, but this does fit into it in the sense that it will provide employment for folk to do the renovations, as well as it will reduce the cost that people will have to pay for rent for apartments that we are providing, thus contributing to the economic recovery plan. Let me also reemphasize that this is phase 1. The other phases are those that can go on concurrently. One of the biggest challenges in this, particularly with the private sector vacant and derelict program, we've been at this for about a decade and had very little success in convincing families who would much rather fight over a deteriorating and non-producing asset than allow us to renovate it and rent it and provide them with some income. We are seeking legal advice about how we might be able to give them greater encouragement to participate in such a program, because in a country of 21 square miles, we cannot afford to have the number of vacant and derelict properties that are currently existing and not being properly utilized. And so we are looking at a number of ways to figure out how we can encourage folk to participate so that they can fight over money as opposed to a deteriorating asset.
We have time for one more supplementary, I'm sure.
Yes, thank you, Mr. Speaker. From my experience in the Bermuda Police Service, I definitely note that it's those vacant properties that also add to the recurring problems that we have in our communities. Mr. Speaker, I would ask the Honorable Minister to, what's his thoughts on when he will update us on the later phases as it relates to those derelict properties within those communities. Thank you.
Minister?
I didn't understand what he was asking.
I can't say I did either, but we'll run out of time, really, so. Yes, I'm doing that now. We've run out of time, members, so Minister, you're off the run on this one. We move now to congratulatory. Thank you.
Derek, just set it for 3 minutes for us, please.
Yeah, just set it up for 3 minutes, thank you. Thank you. Members will now move on to the next item, which is congratulatory and/or obituary speeches. Anyone wish to speak? Guess not. We'll move on then to the next item, which is matters of privilege. There are none. Personal explanations, there are none. Notice of motions for the adjournment of the House on matters of urgent public importance. There are none. Introduction of bills.
Hi, good.
Minister Health.
Yes, good afternoon, Mr. Chair. With your leave, we would like to proceed with Order 8 first, as pursuant to Standing Order 14.3, and I quote, "Government business shall be set down on the order paper in such order as the government shall provide in writing to the clerk." So with your leave, I'd like to proceed with Order 8 first.
Minister, can I just confer one second? Members, bear with me 1 second, please. Minister, please. For the benefit of the listening audience, we're just confirming on our next item, please.
Thank you for being the chair, MP Terrell. Thank you, members, for your participation in the question and answer period. Thank you for the condolence period. We're now on the orders of the day. And the first order is order number 1 in the name of the Minister of, well, it's going to be done by the Minister of Cabinet Office, correctly? Am I correct? Yes. Thank you. Proceed.
Mr. Speaker, Mr. Speaker, with the governor's recommendation, I move that the bill entitled the Payroll Tax Amendment and Validation Number 2, Act 2022 be now read the second time.
Any objections? There are none. Proceed.
Mr. Speaker, I'm pleased to present to this honorable House the bill entitled Payroll Tax Amendment and Validation Number 2 Act 2022. This bill includes both substantive and consequential amendments which are aimed at clarifying and updating our tax laws. Mr. Speaker, this bill will amend Payroll Tax Act 1995 and the Miscellaneous Tax Act 1976 to clarify that certain gratuitous payments received by employees are not subject to payroll tax. This change is intended to eliminate uncertainty in the hospitality industry in relation to customer gratuities or tips, as most of us often call it. Mr. Speaker, it is quite normal for customers receiving personal service or hospitality-related service to leave tips for their service provider, whether the gratuity is paid separately in cash or included as a line item on the customer's bill, as we all familiar with, when you put the 15% or 20%, whatever you want to do. In Bermuda, it has become common practice to include a suggested gratuity amount on a customer's bill. The suggested amount is based on a standard percentage and may be increased or even decreased by the customer. Mr. Speaker, while this practice is convenient for the customer, it is also quite beneficial to employees. Customer tips provide a much-needed boost to the salary or wages of many employees working in the hospitality industry.
Minister, MP Jackson, can you take the seat for me, please?
Please proceed.
As I said, Madam Acting Speaker, Chair, it is, while this practice is convenient for the customer, it is also quite beneficial to employees. Customer tips provide a much-needed boost, as I mentioned, to the salary or wages of many employees working in the hospitality industry, which can be significantly impacted by the second seasonal nature of the business. The customer gratuities can help to offset any reduction of income during the times when there is a slowdown in business. As this part of an employee's income is provided by the customer, it is not considered part of the employer's payroll tax for tax purposes. Very key. It is not considered part of the employer's payroll for tax purposes and should not be treated as such. Mr. Speaker, while this is generally the approach taken by employers for most customer gratuities, some employers in the hospitality sector have treated automatic gratuities as subject to payroll tax, while others have correctly excluded them. The differing treatment is very likely due to a lack of clarity in the law that will distinguish gratuities initiated from and paid by the employer for those paid by the customer. The result is an uneven application of the payroll tax law, where some employees are erroneously paying tax on customer tips while others are not. This proposed change to the legislation will make it clear, specifically to employers in the hospitality industry, that customer gratuities are not subject to payroll tax. Mr. Speaker, there are some who think that we are giving too many concessions or too many exemptions from taxes. However, Madam Chair, this government is committed to providing relief and assistance to the people of this country who need it most. Madam Chair, the relief provided by this bill is not an introduction of new tax relief. However, it is a codification of the existing policy approach that's been administered by the Office of the Tax Commissioner for decades and will help workers who can certainly benefit from such action. It should also be noted that currently the office receives a number of calls from employees seeking clarification about the tax treatment of customers' gratuities generated from their services. Handling these calls and processing refunds for erroneous payments of tax uses critical resources within the Office of the Tax Commissioner that would be better allocated to other necessary tasks. It is vital to both the community and the government to ensure that tax laws are applied evenly and that no undue tax burden is placed on persons working in this sector. Mr. Speaker, as we have continued to highlight, the government has been consistently working to make sure that those who are most vulnerable or who are the lowest income earners receive the help they need to continue to subsist in a time and place where the cost of everything has substantially increased. This government has also pledged to give more support to Bermudian entrepreneurs in cases where we have viable opportunities to eliminate unnecessary financial burdens that disproportionately impact local business owners and self-employed persons. We will accordingly, Madam Chair, this bill will exclude from tax the value of the employer contribution to contributory pension, health insurance, or approved schemes in respect of self-employed persons and deemed employees. These amounts are already excluded from tax in respect of standard employees, but there is no exclusion for payments made in relation to self-employed persons and deemed employees. Mr. Speaker, this amendment would, Madam Chair, this amendment will broaden the application of the law and bring equity to
to the retirement of employees, self-employed persons, and deemed employees within the payroll tax regime. This government wants to encourage self-employed persons and deemed employees to develop schemes and better plans and benefit plans, that provide similar benefits as those typically afforded to employees. We believe that this bill will be an enabler for greater incentives to be realized by local business owners and self-employed persons. Finally, Madam Chair, today's bill will validate the priority policy determinations and treatment of customer gratuities as excluded from remuneration for payroll tax purposes. This bill will also validate any orders made by the tax commissioner on behalf of the Minister of Finance to approve, vary, or revoke approval of contributory pensions, health insurance, and other approved schemes. Last year, changes were made to the Payroll Tax Act 1995, authorizing the minister to delegate authority to make these types of orders to the tax commissioner. The aim of this delegated power is to reduce bottlenecks and improve efficiency in the approval process. That delegation order has now been published. This validation will cover any such orders made by the tax commissioner since April 1st, 2021. Madam Chair, in closing, I would like to thank the technical officers within the Office of Tax Commissioner for the work on this bill and for their continued work on behalf of the government, providing tax administration services to the people of this country. I would also like to thank the staff in the Ministry of Finance and the Attorney General's chambers for assisting in this effort to bring forth this bill. Thank you, Madam Chair. I wait to hear from others. Thank you.
Thank you, member. Is there anyone else that would like to speak to to the Payroll Tax Amendment and Valuation Number 2, Act 2022?
Thank you, Mrs.
Opposition Leader, you have the floor.
Thank you very much. I see this here as an opportunity to help small businesses during these difficult times. Under the 1995 Act, which is the Payroll Tax Act of 1995, it states that the prerequisite for the pay for filing includes bonus, salaries, wages, vacation leave, commissions, gratuities, etc. This legislation clearly takes out the gratuities once it's passed. The previous speaker indicated he was talking specific gratuities. I'd like to see where that falls into a line with the legislation. I wouldn't, Mr. Speaker, Madam Speaker, I wouldn't restrict this to the tourism industry because there are a number of professions that deal with gratuities and gratuities form a large part of their salaries. And I'm thinking of attendants at service stations. They make 70% possibly of their salaries from the gratuities. So again, this can apply to other services providers across the island. The challenge or the question that I have is if we're adjusting and taking out gratuities for the payroll tax purposes, how does this align with the minimum wage? I know the Honorable Derek Burgess was chairman of the Minimum Wage Commission, and this would be directly related to the minimum wage. Because if the employees have the gratuities stripped away, then what will their basic wages look like? The other question that I have is in regards to regulations on these gratuities. Because we know if we go into a restaurant and other service providers, they have in their pricing structure a line which says either 15 or 17.5% for taxes, and that's automatic. And that is spread throughout the service providers, let's say a restaurant. So they get, management gets a piece, the chef gets a piece, the waiter gets a piece, the dishwasher gets a piece. And so how is that managed? Or is it totally left to the discretion of the financial institution or the service provider? And how are we going to ensure that those employees, in essence, get is what's due to them, Madam Chair? And the other question is the legitimacy of how these gratuities are arrived at. Because some restaurants may have 15%, others may have 17.5%, and others may have 20%. Who is authorizing those additions to one's restaurant bill or hotel bill? How can that be addressed? Because we are taking gratuities out of the purview of the payroll tax calculation. And that was, as I said earlier, a crucial part of employees' salaries, and there was some degree of control and regulations. But now they're taken out and are in a separate basket, and I think more examination needs to be adhered to.
Point of order, Madam Speaker.
Yes, member, what is your point of
There's
order?
no separate basket. They're just not being taxed. The same way they get it, they'll get it the same way, but they're just not being taxed.
Thank you. But while on gratuities, because the whole act evolves around gratuities, I would like to know how, if we go from one restaurant to another restaurant, from one hotel to another hotel, embedded in their final invoices is an alignment for gratuities. The only way that we can ensure that our service providers get money in their pockets is for the guests or clients of these hotels or restaurants take and put $10 in the hands of their waiters or waitresses or service attendant. But yet, the hotels and restaurants are able to charge a 15 to 17, or in some cases, try to get 20% for their gratuities. So again, I think there should be some method in place to give the community comfort as to how these embedded gratuities are arrived at. And maybe it's time to look at some type of regulations on that. Because at the end of the day, people are saying our destination is very, very expensive. And I think these embedded gratuities may lead to that. And so I just like, before we get in committee, register my concern in regards to how these gratuities are managed now that they've been taken out of the calculation for the payroll tax. I know it helps the small businesses, but how does it help, and what are we doing to protect the waiters, the gas station attendants? What are we doing to protect them in regards to their gratuities that go in their pockets that help sustain them? Thank you.
Thank you, Mr. Acting Speaker, and I thank the Minister for the Cabinet Office, Wayne Ferber, for holding this bill in the Premier's absence. Mr. Acting Speaker, I just have two short points to follow on from the primary speaker from the opposition leader. The first is really what is this bill doing? And I would, with your leave, Mr. Acting Speaker, quote from the explanatory memorandum at the back page. It states this: "This provision clarifies the current practice that a gratuity originating from the customer for services rendered does not constitute remuneration." So even the explanatory memorandum of this bill explains that all it is doing is confirming current practice, which begs the question, Mr. Acting Speaker, why and why now? Why announce what already exists? Why create the impression that something is being done when, with the greatest of respect to the acting minister, it is not? I'm grateful that the minister recognized in his own speech that this is, quote, not new relief, and we respectfully agree with him. So if it's not new relief, why is the government telling the public, quote, this government is committed to providing relief to those who need it most, end quote? This is no new relief. This is just confirming an existing position. It's nothing new. It's like taking credit for the sun rising. The sun was rising anyway. And so why are we doing this? And why are we doing it now? The reality is this bill is not going to save anyone any money, as it just reflects what already happens with people's tips. It is completely revenue neutral, and I'm grateful for the minister recognizing that when he opened the bill by saying it is not new relief. Quote. My second point, even shorter, is just on the bit about self-employment. Again, this is nothing new. Unfortunately, because of poor drafting previously, self-employed people had to actually pay tax on their own premiums for their health insurance. And that is daft, and it never happened. So the idea that it did happen, or the idea that there was a bottleneck which is now being cleared, again, is complete and utter nonsense. No self-employed person in Bermuda has been paying tax to the government on their health insurance premiums. It doesn't happen. It hasn't happened. And I'm glad the government's clarifying it. But again, why? Why now? Nothing is being done here. The sun will rise anyway.
Any other member wish to make a contribution at this time? There are none? Minister?
Thank you, Mr. Speaker. It shows the difference between a lawyer and an accountant. So if your gross pay is $1,000, if your gross pay is $1,000, and inside that was a deduction of $1,000 for health insurance, and $500 was supposed to be for the employee, and $500 for the employer, because that's what he had to pay. Now the individual will not have to pay taxes on that $500. So the payroll.
Point of order, Mr. Speaker.
Point of order?
The honorable minister is misleading the House. We are talking about self-employed people, so there is no deduction by the employer.
Minister?
Madam, Mr. Speaker, let me explain to the lawyer once again. If I'm self-employed and I get a gross pay of $1,000, that deduction, which included me paying on my health insurance, which included I pay the payroll tax, whatever, the payroll tax, I thought it was 8%, I can't remember what the percentage is, but 8% on the 5,000, right? Now I can deduct my portion of my health insurance that I paid for myself, employee and employer. So instead of deducting payroll tax on the 5,000, I now deduct.
Point of order, Mr. Speaker. Again, the honorable minister is misleading the House. It's not a deduction, it's an exclusion, and you're amending an exclusion.
Minister?
Mr. Speaker, I'm not going to keep on going over this again. But there's a difference between paying payroll tax on $5,000 and paying payroll tax on $4,500. There's a difference between paying payroll tax on $5,000 and paying payroll tax on $4,500, because it now allows the self-employed, who has now paid $1,000 to BF&M for his portion and the employer's portion, because you pay half-half. Because right now, for your portion, you only pay as an individual that works for a company, you only pay on your portion. So when the BF&M bills me, they bill me for $1,000. anyway. So he says no new relief. Well,
Point of order,
not-
Mr. Speaker.
Point of order.
The Honorable Minister's misleading the House. The Honorable Minister said, quote, "This is not new relief," not me.
Minister?
Mr. Speaker, there is no direct relief coming from the government per se. Okay, we all agree with that. But the employee who was paying on the gratuities. So I get $1,000 salary, and then I get $500 in the gratuities. So it's $1,500. So instead of paying a percentage on the $1,500, I now pay a percentage on only the $1,000. So there's a relief for the individual. There's a difference between lawyers and accountants, I'm assuming. I'm sorry, not my friend. But there's a difference. So that person, instead of paying 8% or whatever, 6% on 1,500, he pays 6% on the 1,000. It's simple. It's not hard. So now the government is allowing that individuals to take home more money. It's straightforward. So it allows individual, particularly in the hospitality industry, and if you are in the gas station and get a tip, you also do not have to pay. Now there are some who did put in the pocket. We accept that, and that's why we spoke about there were individuals who were not paying for it, but you was caught up in the restaurant. Now, if you're the president of a company and get a tip, then you don't pay it. Basically, it covers everyone. It's not hard to understand, everybody. So, the minimum wage. The honorable member, leader of the opposition, mentioned about the minimum wage. That will be addressed by the honorable member, Jason Haywood, as time goes on. But the government has looked at the tips or gratuities in that also. So that will be answered by the minister when that all is done. I believe I answer. And it's not restricted to just the hospitality industry. It's restricted. It's everyone. If you get a tip, whether it's in a gas station, whether somebody's cleaning your car, whether it's whatever it is, as long as a tip, gratuities, we know as a tip, then you do not. Now, there are people who did not pay it. We know that. And there are industry that did pay it. So overall, it benefits the employee to agree. So thank you, Mr. Speaker.
Thank you. We're going to committee now, Deputy, because the minister, the affirmative is the one who led the debate. You ready to go to committee? It's 12:30. I would suggest that we go to lunch and then come back and
That's
go to committee.
I agree with you.
Okay. Premier?
Thank you, Mr. Speaker. Mr. Speaker, I move that this honorable House now adjourn until 2 p.m.
Any objections? There are none. And House now stands adjourned until 2 p.m.